Okay, hello everyone. Thank you for joining us today. We are welcoming SteadyHeart's first guest speaker, Dr. Muthuswamy. SteadyHeart is a student-led organization dedicated to helping our community lead a heart-healthy life by educating others about heart diseases and fundraising for ongoing research. With a loved one losing their life from cardiovascular disease every 37 seconds in the United States, we believe this topic is crucial to discuss. My name is Kavya Kadabagari, and Ananya Pradhan and I are co-founders of this organization. Hi, Ananya.
Hi, Kavya. So in today's meeting, Dr. Muttaswamy will be discussing mental health and its connection to the heart. She's a board-certified psychiatrist and has been practicing in East Brunswick for 15 years. She was also the assistant professor at Rutgers University Behavioral Healthcare and has been involved in promoting awareness for mental health and developmental disorders. So welcome, Dr. Muttaswamy. Thank you for being here today. How are you doing?
Thank you so much for having me here. I'm doing fantastic. How about you guys?
I'm good. Thank you.
I'm very glad that youngsters in our community are actually taking this and doing some meaningful work about it. Kudos to you guys.
Thank you. We really appreciate it. And thank you for being here.
Welcome.
So we are excited to hear your perspective on how mental health affects the heart. So would you like to share your thoughts?
Absolutely. So when people think of cardiac health, they seldom think about mental health component associated with that, particularly how mental health either aggravates or relaxes your cardiac health, and also the effect of cardiac health on mental health. Usually when we think about heart, we usually think about diseases like diabetes, high blood pressure, and people usually talk about just food habits, controlling your diabetes and maintaining your blood pressure under control. It is very rare that even when we go to a physician's office, that they're going to talk about your mood, your anxiety, having an impact on your cardiac health. There has been multiple studies that have shown that your mental health is equally as important as controlling your diabetes and high blood pressure for the cardiac health. For example, if we take stress as a factor, it is a big causative factor for causing heart attacks. But people usually think okay, you're stressed out, so you're having a heart attack. So that's not how it actually works. There is actually a physiological component behind this. When people are stressed, our hormones go into an imbalance. And what happens with that is with the stress, our body releases two kinds of hormones, the adrenaline and the cortisol. It is what we call as a fight or a flight enzyme, right? When we were upset or angry, our adrenaline level goes up. But what happens when our adrenaline level goes up? For example, if you're stressed, even for kids like you guys, if you're stressed about any kind of sports, you're stressed about your academics, you're stressed about doing a presentation, the first thing that you will notice is kind of like a butterfly sensation in your stomach, right? And then people have also talked about palpitations. Their heart starts beating fast. When there is palpitation, we have to understand that palpitations is actually an increased heart rate. So what stress does is it increases your adrenaline level, and the adrenaline level increases your heart rate. When your heart rate goes up, this is what happens. Excuse me. Your heart beats fast. When you look at cardiac health, first your atrium contracts, and then it pushes the blood from the atrium to your ventricle. And then your ventricle contracts and the blood goes through the body. And there needs to be a time frame for the atrium to contract so that the blood comes into the ventricle and hold it before it goes out. For example, if you think that your heart is beating super fast, they go like this. So when the atrium contracts, the blood goes in there, but not all the blood empties into the ventricle. So that means that there is lesser amount of blood in the ventricle, and the ventricle starts contracting fast. That's your heartbeat, right? So there is only less amount of blood that is coming out of the heart. And if there is a less amount of the blood that is coming out of the heart, let us not forget that there is less blood flow to the organs. And when there is less blood flow to the organs, less oxygenation. Less oxygenation can result to stroke. And people also start feeling numbing in their fingers and hands. And that comes because when there is less blood flow, our body automatically realizes that they have to protect the critical organs. And what are the critical organs? Brain and our gut and lungs, they are the critical organs. So our vessels, blood vessels on the fingers and toes starts automatically contracting to preserve. It's kind of when, let's say there is a big snowstorm and current goes out. Everybody tends to come into one room, right? We are trying to conserve the energy. So that's what our body does that too. So it tries to conserve the amount of oxygen to the critical organs. So that means blood flow to the rest of the organs gets cut off or get decreased. This is just one example of what a stress can do a multitude of changes in your heart. Imagine if somebody is in a constant state of stress. Imagine if somebody is in a constant state of worry, whether they are worrying about finances, whether they are worrying about physical health, whatever it is, this adrenaline level gets reset in our body. So if our adrenaline level gets reset, that automatically resets our heart health. So that there is a direct component of how a mental health can physiologically affect our heart health. So that is one component of that. If you flip the side of the coin, we can say how the heart health can affect the mental health. For example, let's say like somebody suffers from a heart attack. It is a very life-threatening situation, right? The first thing that they are going to happen is like, once they recover, they are going to worry, is this going to come back? Right? That's the biggest worry that they start having. What if I have a second heart attack? What if I have a third heart attack? Is my finances are under control? Or my kids grown up? Or how are they going to provide for themselves? Is my kid in college? How are they going to pay for college? So this multitudes of worries starts happening because now they are worried about their mortality. They're worried about like what could happen. The second thing that they're going to worry about is they're going to get depressed. Because once this happens, because any major life event happens, it's going to cause depression. And what is the depression going to do? The symptoms of depression, when you look at it, is lack of energy, lack of motivation. That means like lack of motivation to do things. When they get out of the hospital, say after a big cardiac event, the cardiologist would give them a list of activities to do, right? Like, that you need to eat healthy. You need to start exercising. You need to start slow, but you need to take care of yourself. You need to start exercising. You get depressed. You don't feel like getting out of the bed. You don't feel like, getting into the shower. You don't feel like taking care of yourself. And if you are not doing that, that means like you're not eating healthy. That means like you're not taking care of yourself. So you're setting up a stage for not only a poor recovery from a cardiac event, but you're also setting up a stage for further cardiac events. So the heart health can also flip and cause a mental health. The other way the heart health can cause a mental health issue is there are like few percentage of people, between 3 to 5% of the people who have had a significant cardiac events develop PTSD. Because it is a trauma, they developed a post-traumatic stress syndrome. On top of that, some of them develop a very debilitating illness called panic disorder with agoraphobia. What that is like, let's say like, if somebody's cardiac event happened outside of the house, and there are like, people, neighbors, or like, passerbys ended up calling the ambulance and they end up in the hospital and they come back home. Their biggest worry is going to be, what if another event happens when I am outside of my comfort zone? What if another cardiac event happens when I am not with my family or friends, or there is no neighbors or somebody to call the medical help? So they try to stay indoors. They are now afraid to get out of the house. And then what happens if they're afraid to get out of the house? Then they are going to be very afraid to go grocery shopping. They're going to be very afraid to go to their work. So this causes what we call as ripple effect. This panic disorder can cause a ripple effect in not only their family, but also it's going to affect their spouses, their wife or husband. They are going to be worried too. And it is going to have an effect on the children because they are seeing that their parent is not recovering from an episode or an illness. So this cardiac event in one person can not only cause a mental health issue in them, but also it can cause what we call as like a ripple effect mental health issues in the family. The spouse can get depressed. The kids can get depressed. So, and that can affect their academics. And now this becomes like a cycle. Now the parents are going to be worried about, oh my God, my kid is not doing well at school. What happens? Then they start worrying more. And then this sets up a stage, a big stage for cardiac events. So this goes back and forth. And I also want to mention a third very important thing. It is not only mental health affecting cardiac health and cardiac health affecting mental health. There is a big chunk of medications that can cause cardiac effects. For example, if let's say like if somebody is being treated for bipolar disorder, or somebody is being treated for schizophrenia, or any kind of mental health illness, particularly we call a group of medications called atypical antipsychotic medications, which is very extensively used to control anger, aggression, for all kinds of things. One of their major side effects is increased weight gain and insulin resistance. Two major culprits for cardiac events. Insulin resistance can lead to diabetes. Your increased weight gain can lead to obesity, which is a huge risk factor for cardiac health. So the medications can also put somebody at a risk for a cardiac event. To this day and age, so what has recommendations has changed, not only from CDC, but also from American Cardiac Association, is anybody who is getting discharged from the hospital after a cardiac event they are being screened for depression and anxiety, without which they are not getting discharged from the hospital, because that is paramount at this time for any kind of effective cardiac health. Effective mental health component is going to be a bedrock in addition to the treating of their high blood pressure, diabetes, their food health, and their cardiac health. That is also becoming one of the bedrocks for effective cardiac outcome after any kind of a negative cardiac event. So when you look at it, it's all connected. It's not like one organ in the body that is going to just take care of itself. So when it comes to cardiac health, definitely, as not only as physicians, but also as young kids like yourself who are eventually going to be physicians, parents, everybody should put the mental health on the top of the list as some of the things that they need to take care of as part of the cardiac health. Hope that helps.
Yes, it does. Thank you, Dr. Muthuswamy, for explaining how mental health affects the heart and also how the heart affects mental health. It was also interesting learning about how specific medications that a person is treated with who's going through mental health disorders can put them at risk for heart disease. Now we will open up the session for any questions you guys may have for our guest speaker. To ask your questions, you can raise your hand or unmute yourself. Or you can put it in the chat if you feel comfortable doing that.
So you mentioned that if there was a persistent stressor in your life, your adrenaline could reset. So what happens if that stressor goes away? What would happen to your adrenaline levels?
Okay, so let us say if your stress level goes away, it takes a quite an amount of stress to reset the adrenaline level. Every time there are two kinds of stresses. There is an acute stress and a chronic stress. If there is an acute stress, your heart rate goes up, but it's a short-lived period, right? When you guys are worried about test or anything like that, you will feel the palpitations. And once you're finished with the test, you're calm. That goes away. But don't forget, every time that happens, it's what we call as a mini assault on your heart. But let's say that somebody has a chronic stress, that they're constantly worried about things. They're constantly worried about how they are going to do in life, how they are going to do this, how they are being perceived by their friends. And if that constant stress continues, excuse me, the adrenaline level resets itself. So it becomes a hair trigger reaction. So it is kind of like you do a behavior. It's let's say like cycling. The first time that you learn cycling, you have to, when you try to ride a bike, you have to focus on where your pedal is, where your brake is. But after 5 or 6 years, you sit on the bike, automatically you drive. So once the adrenaline level resets, this is what happens. Even a small stress happens, it automatically jumps to a higher heart rate. It automatically jumps to a high blood pressure because now it has become a learned response for the body, which is not good. So we need to have a positive learned responses for the body and not the negative learned response.
So basically what happens is when the stressor goes away, and even if you experience an acute stress, you're going to get a lot more stress than you usually would have.
Yeah.
Okay.
See, the thing is once your adrenaline gets released in the body, it doesn't go away automatically. It takes another 4 hours for our liver to process that adrenaline and to break it down. So even though you don't feel the palpitations after your test or something like that, there is what we call as post-adrenaline crash is happening in your body because your systems are dealing with that assault for another 3 to 4 hours till it is completely gone.
So I have a question, like sometimes it happens like in everyone's life, maybe some of the people, sometimes I feel like it's not, I don't understand like it is stress or what, but my heartbeats goes like suddenly like, more faster than usual, maybe some thoughts or something, I don't know, but, and my both parents had a heart disease. So maybe because of that, I don't know. But what the first thing we should do if it is something happen like suddenly, what we can do, like,
one of the things, like if you have a history of heart disease, if your family has a history of heart disease, and let's say like you're having palpitations, what we call as palpitations that does not have background reason for that. For example, like, if you are stressed and you have a palpitations, that there is a cause and an effect. But you're like, all of a sudden you're starting to have palpitations and you need to be worked up. Anybody who has it needs to be worked up medically for a few things. One is definitely for thyroid issues. Is the thyroid is like wreaking havoc in your body that is causing palpitations, or is it any kind of rhythm disturbances in your body? And if all those things come back negative, then at that point we have to definitely look and see, like, are you having unconscious or subconscious stress levels that is making you to have palpitations? Because you're not consciously aware that you are worried. But your unconsciousness is kind of picking on that and releasing hormones, and physiologically your body is reacting to that. A classic example I would give is that, like, let's say, like, even if we don't feel stressed, let's say, like, if somebody has to perform in front of the stage and they are not happy with performing, they may not physically look anxious, but one thing they'll say, like, I feel like butterflies in my stomach. It's a physiological response. They are not consciously aware of it, but their body has already secreted adrenaline that is being processed in their gut, and they're feeling it as the butterflies in the stomach. So it's, if there is not a thyroid issue, if it is not a rhythm issue, then we should definitely look into one of the differential diagnoses for palpitation is anxiety.
Oh, okay. It may be my hormonal, because last year I have a uterus removal surgery. So before that I was feeling too much. Now I don't. So maybe right.
Yeah,
Okay. Thank you.
it could be hormonal. As I said, like, but one of the things that we usually, like, we recommend as psychiatrists is, like, when you're looking for a differential diagnosis for any symptoms, do not forget to consider the mental health aspect of it. And the vice versa too. If we are seeing somebody with depression, it doesn't make sense automatically the depression is all psychological. Pancreatitis is one illness that's first symptom presentation is depression. Pancreatic cancer, the first symptom presentation is depression. So most of those, our body symptoms, it can come from mental health, or the mental health can cause physical symptoms.
Okay, got it. Thank you.
Welcome.
I have a question. What's the best way to manage stress, in your opinion, to keep yourself from having detrimental effects on your heart?
See, one of the things is, like, when we think about stress, we should also think about strategies, because all of us would have stress in our life at some point or another. There cannot be a single person who can say, like, I always lead a stress-free life. That is humanly not possible. So we will always be having stress. So one of the things to have in your arsenal of tools is relaxation techniques and strategies. Always, like, for one thing that works for one person may not work for the other person. Some of the common tools that would help with the stress level is kind of like, deep breathing, which anybody can do at any given setting. It is kind of like, you take a deep breath through your nose and you hold your breath for at least 3 to 5 seconds in your lungs. And then you try to exhale it through your mouth. And you try doing that 4 or 5 times. What happens is, like, physiologically, your heart rate cannot go up, because your breathing regulates your heart rate. When you're breathing in and your lungs are expanding, your heart rate automatically goes down, because your heart is, like, wedged between the two lungs. So when the lungs are expanding, it's like, it's a very physiological response. So that's one of the reasons people say, when you start having palpitations, take a deep breath. The deep breath physiologically would stop the palpitation. But also what the deep breath does is, like, it brings in a lot more oxygen to your body. Remember, one of the things that happens with stress is, like, when the blood gets out of your heart super fast, they don't have enough oxygen in them. Taking the deep breath is also going to physiologically provide a lot more oxygen to your body. So when the lot more oxygen goes into the body, let's not forget this, most of the oxygen is going to your brain, which is your processing center for stress. When somebody is stressed, they cannot think clearly. The reason is because there is not enough oxygenation to your brain. Your executive function is not like working as well as you would expect it to. So with stress, and you do the relaxation techniques and the breathing techniques and things like that, you're physiologically improving your oxygenation to your brain in the hope that you are going to make effective decisions and not impulsive decisions. Squeezing the ball, when you look at it, it's a physiological action. You squeeze the ball, you're releasing the energy, and that means like your brain and the hand has to function. So the oxygenation to that part of the brain increases. All those relaxation techniques are working and gearing towards increased oxygenation to your brain. Increased oxygenation to your brain decreases your stress level. So any relaxation techniques that would do that, even yoga. In yoga, we take a deep breath. In meditation, what are we doing? We are controlling our heart rate and breathing. So anything that works on that, the cardiac pulmonary thing, cardiopulmonary unit, is going to decrease your stress level and anxiety. So the goal for anybody is not to lead a stress-free life, but to lead a life that you can effectively manage the stress.
So there's a question in the chat. So Naomi asked, as a psychiatrist, is it stressful to constantly be helping people with their mental struggles? So how do you maintain your own mental health on the job?
Okay. See, one of the things is like, I don't see my job as stressful. I like talking to people. I like talking to people about their issues, and I like figuring out a way with the patients about like, how to help them during any kind of situation. So it's a two-way street. As a psychiatrist, we don't work all by ourselves and like, prescribing medications and things like that. It's a collaborative effort between me and the patient that I am seeing. So since I'm in a partnership with everybody that I works with, I am not like shouldering all the stresses and things like that. Together, we are trying to figure out a way what would be best to help their situation. And the top of that, I enjoy what I do. So that is, for me, that is the goal in life. If you don't like what you do, you're going to be stressed, and that's going to cause a lot of tremendous amount of like, challenges with you and for your family. I love what I do and I love my field. So for me, it is easy because this is what I like to do. So my like, advice to you is like, in life, do what you love. Everything else will fall into place.
Thank you for that answer. Another question I had was, how common is it for a heart disease or a stroke patient to develop mental health issues after their treatment?
2 out of 3 patients do develop that. So that means like it is almost 66%.
That's a large.
After a cardiac event, they develop depression or anxiety. That is, when you look at it, it's a very high percentage. Imagine like, for example, if you take any big city emergency room, they would usually have anywhere between like 10 to 12 cardiac patients in a, in a day. 8 of them are going to develop depression or anxiety upon discharge, whether it is acute for a shorter period of time or chronic, but they are going to develop that. Because any cardiac event, you look at it, it is a brush with their mortality. Their life is changed. Their life they know has changed because of one event. And that is going to have repercussions on their mental health, and that's what happens.
Thank you for your answer.
You're most welcome.
I have a question.
Do patients develop mental health? Do people develop mental health disabilities or anything when they experience when something stressful happens in their life?
Okay.
Or
not everybody who has like stressful life events develop mental health issues. For any kind of disability, to answer your questions, to develop a disability, there needs to be like a multitude of factors that has to go into play. One is like you need to be genetically predisposed, just like people are genetically predisposed for high blood pressure, diabetes, and cardiac events. People also are genetically predisposed, what we call as biological component, genetically predisposed to develop depression, anxiety, bipolar disorder, or whatever it is. So that's one component. The second component is what we call as our psychological component. When you look at it, when you put two people in the same stressful situation, both of them will not have the same outcome, because that comes from their psychological makeup, what we call as defenses. However, they are their development, their upbringing is going to instill in them certain amount of defense mechanism that may be effective in dealing the stress or not effective in dealing the stress. So there is a biological component and there is a physiological component. So those two, actually, there needs to be a perfect storm for anybody to develop a mental health disability. Having said that, a lot of us do have like mental health symptoms periodically in life. We may be depressed for a while, we may be anxious for a while, we may be feeling stressed out for a while. Those are all mental health symptoms. They are mental health diagnosis. That does not necessarily translate to mental health disability. For disability to happen, their social and occupational functioning should suffer, meaning that they should not be able to do what they are required in life. If somebody is a student, then their academic suffers. If somebody is like an adult, they are not able to go to work and they are not able to maintain a livelihood. So for a disability to happen, that component should be present. So that depends on your biology and also on your psychological makeup.
I have a question. So have you had any experiences with your patients that show the specific connection between the heart and mental health?
Yes, actually, particularly in my adult patients, I have quite a few number of adult patients who I started seeing much later in their life. They have never had any kind of significant depression or anxiety in their young life. But once they have had like a cardiac event, I have been seeing quite a few of them and treating them for mental health issues, particularly depression and anxiety, which is very common. As I said, like it's 2/3 of the population who has a cardiac event can develop a mental health challenge. But not everyone is going to develop a major depressive disorder or a generalized anxiety disorder. Quite a few of them do develop that, but there is a sizable population who go through those kind of symptoms.
So you mentioned how the medications given to mental health patients can cause them to be at risk for heart disease. Do you think it's necessary for to find alternative drugs that don't cause them to be at risk for heart disease?
There are alternate drugs that are used for that particular condition, but when you look at it, it's a question of benefits versus risks. Those medications have a different kind of side effect profile, like what we call as EPS reaction, extrapyramidal side effects that causes some neurological changes. So this group of medication causes cardiac complications. But when you flip it, for example, there are some allergy medications that can cause depression. So there is not a single medication that has not have any significant side effects. Most of them do. It's a question of depending on what enzyme system or what hormonal system they are treating, the symptoms are different and the side effects are different. Yes, to answer your questions, it would be fantastic if we can have an antipsychotic medication that does not cause a cardiac side effects or a neurological side effects. These medications came into play because the neurological side effects were very debilitating. It was causing facial tics, it was causing movement disorders, they were not able to walk. You are treating their significant mental health issue, but it causes a neurological symptom. So to combat that, these group of medications came in, which was fantastic when they came out because we didn't see any motor movements. Fantastic. But over a period, we realized that these medications cause insulin resistance. So they put them at a risk for cardiac events. So eventually we may end up with a medication that does not cause this. But having said that, but we kind of jumped from a neurological side effects to the cardiac side effects. And I hope that we get into a medication whose side effects is not as debilitating as either one of them.
Okay, thank you.
Welcome.
So you mentioned that if something traumatic happens to the heart, they have to be screened before they're allowed to leave the hospital. Does that happen with other organs or is it just specifically the heart?
It happens with a couple of major life events. If somebody has had a stroke, they will be screened for depression and anxiety, just like if somebody has had like a cardiac event and somebody has got like a very life-threatening diagnosis of any cancer diagnosis, yes, they do get screened. So any kind of big life-changing events, they do get screened for depression and anxiety before they are discharged from the hospital.
Could the depression occur later on, like a few days or a few weeks after the event, or?
Absolutely. So only, as I said, like it's only a screening tool before they get discharged. So every time, the recommendation is like every time that they get followed up for their cardiac event with their cardiologist, the two questions the CDC recommends, as well as American Cardiac Association and American Psychiatric Association recommends for the physicians to ask them is like, how do you notice your energy level? What is your motivation level? And how have you been sleeping? Three things which is physiological would give us a clue to whether somebody is developing depression. If they're having sleep disturbances, and that means like that they're worrying about something, and that could be like a precursor for a depression or anxiety. If somebody says that they have a lack of energy, that could also foreshadow an upcoming depression, like, or anything like that. And lack of motivation also would be for depression. So these three questions are usually suggested as a screening questions during every visit to your primary care physician and your cardiologist as part of the cardiac workup.
So Naomi wanted to know what a typical day as a psychiatrist is like.
My day is now very different after the COVID. Now I do only like telehealth sessions. But before COVID, as a child psychiatrist, I can tell you like what my experience as a day is. I used to work at Rutgers Behavioral Healthcare, and I used to run the Adolescent Day School program. That's a school program for kids with mental health needs. So for that, my day usually starts around 8:30 in the morning, because that's when school starts, because it's a middle school, high school combined program. And I would be as part of the school, talking to the kids, talking to the teachers, the child study team case managers and social workers, managing their medications and crisis. And my day was like 8:30 to 4:30. Now I do predominantly private practice. I'm like, almost 90% private practice at this time. So my day is kind of like starts around 9:30 right now because of the COVID situation. I don't have to go to work. And I'm doing telehealth sessions. There are like, commitments to evenings and weekends. So if anybody of you guys are like, looking to be a psychiatrist, or particularly a child and adolescent psychiatrist in the future, there is a component that you would definitely have a good life work balance. It is stressful only if you think of it as stressful. As I said, like, I love being a psychiatrist. I love being a child and adolescent psychiatrist. This is my passion. So talking to people is usually not a stress for me. In fact, both my kids feel like, that I would as well spend time with my patients and spend time with them. So it's kind of like, I love what I do. So my typical day starts around 9:30. I take a break for lunch and I work 2 evenings. And then there are like Saturdays I work on as needed basis. And when there is a crisis or when there is an emergency with a kid or my patient, then I'm available.
You touched on how mental health medications could affect your hormone levels in the body. So considering this, how does it affect your willingness to give prescriptions?
See, whenever I write a prescription, one of the things as a physician that I look into is like, what is the benefit versus risks? Does the benefit of going on this medication outweighs the risk that it is posed? For example, let's say like I'm writing this medication that can cause insulin resistance. I usually write this medication to somebody who has a bipolar disorder or schizophrenia, meaning like, that they are not able to work, their mood is all over the place, that they have not been sleeping, that they are probably in an inpatient setting or an outpatient setting where they are not able to do anything. So I'm looking at that as opposed to the probability of them developing an insulin resistance 5 or 8 years down the road. So that is how, like, I look at the benefit versus risk kind of scenario to see for each individual patient, does the benefit of taking this medication outweighs the risk that poses? And I think like just not the psychiatrist, like any physician who writes a prescription always ask that questions to themselves, whether they're writing the insulin script or whether they're writing the prescription for high blood pressure, which also has like other side effects. Does it make sense for them to go on this medication, or there are other alternatives with less side effects?
This is another question from Naomi, and she asked that as a psychiatrist, how much do you need to know about the heart?
As a psychiatrist, everybody has to go to medical school. Everybody has to go to medical school. As a psychiatrist, I'm into medical school. Just like after medical school, you choose either like pediatrician or like an internist or anything as a secondary thing. Then I did psychiatry and then I specialized in child psychiatry. Think of it this way. Everybody goes to medical school. For somebody to become a cardiologist, they will do internal medicine for 3 years and then they will do a specialization in cardiology. And after medical school, I did my residency in psychiatry and then I did child fellowship. So as part of being a psychiatrist, we have to do a year of internal medicine, including time at either ICU or cardiac care unit. So that is part of like, it's a very well-rounded education.
Thank you. Another question I had was, how do you know when to see a psychiatrist?
Okay. So one of the things is like when anybody, whether it is a child, adolescent, or an adult, when you feel like, that you're stressed out or when you feel like that you're not doing well, you'll have that sense. Or the parents feel that they are not doing well. Or as an adult, if we feel we are not doing okay. First thing, bring it to your primary care physician. Because your primary care physician can look at the whole system and see like, okay, you have high blood pressure or you have diabetes or you have had like a thyroid issue. They can go through the panel to make sure that any of these symptoms are not coming from your hormonal imbalance, which can be treated by a hormonal treatment. For example, low thyroid can cause depression. So, and anemia can cause depression. High thyroid can cause palpitations and anxiety. So they, as a primary care physician, they will look into all those things that needs to be looked into and say like, what, it doesn't look like a physiological cause, you're depressed. At that point, they will refer you to see a psychiatrist or first start talking to a therapist. So that's a correct way of doing things, because your primary care physician can make sure that you are physiologically okay at this point. And then like, this needs to be addressed in a secondary level.
Thank you for your answer.
Yeah.
Some people say that mental health isn't really important and you should, most people should just be able to like tough it out. What would you say to those people?
Okay, this is what I usually tell people who ask me that. If let's say like if somebody has asthma and they're having a breathing trouble, would you tell them just tough it out and breathe okay?
No.
They can't. It's exactly like that. Mental health issues have a physiological component. Just because you cannot see something does not mean it does not happen. For example, if somebody has low blood glucose levels, you don't see that their blood glucose is low. You see the symptoms of it. You see them feeling dizzy. You feel them sweating. And so you address it. So when somebody is having a low serotonin level, that causes depression. When somebody is having a high adrenaline level, that is causing anxiety, you're only seeing the symptom that is being presented. So there is nothing like tough it out. You will not tell somebody who is having a heart attack and say, I have a chest pain, tough it out, be a tough guy, get up and walk. Nobody says that to them. Nobody tells an asthmatic kid, hey, forget your inhaler or a nebulizer. Who cares? Take a deep breath and walk out. Then why would you say that to somebody who has depression? Say, your brain is inside your body. If you take care of your heart, if you take care of your lungs, if you take care of your bones, why would you not take care of your emotional health? So that's the answer I would tell them. If you can tough out your asthma, if you can tough out your heart attack, you can definitely tough out your depression. But if you cannot tough out your heart attack, and if you cannot tough out your asthma, then what is the probability of that you can tough out your depression?
Okay. So what are some non-drug related prescriptions that you give to your patients?
Okay. So the thing is like what we call when we talk about non-drugs, so there is non-pharmacological intervention. Non-pharmacological interventions are usually what we call as therapeutic interventions. Those therapeutic interventions are for counseling. So there are a lot of licensed clinical social worker or psychologists or even psychiatrists do therapy. There are various forms of therapy. There is a supportive form of therapy that is usually starts initially when somebody is getting out of a cardiac care unit, supports them, makes them like, able to talk about their thoughts and feelings and things like that. And there is another kind of therapy called CBT, cognitive behavioral therapy, which is specifically to address depression and anxiety over a period of 16 to 20 weeks. The underlying concept is you challenge your negative thoughts and you retrain yourself to kind of, instead of seeing a cup as an half empty, but as an half full. So, but it is a behavioral technique. It's a cognition and your behaviors, how your thoughts affects your behaviors. And the concept behind the CBT is like you change your behavior so that you can change the thoughts. So that is another form of therapy, that is CBT. Then there is something called interpersonal therapy, where you work on relationships. When let's say like your depression or anxiety are coming from conflicts within a relationship, so you work on those kind of conflicts to teach you conflict resolution so that you can improve your personal relationships and decrease the stress. So those are some of the non-therapeutic, non-pharmacological interventions that we suggest.
I have a question. So how did you get into, like, how did you choose your career to be a psychiatrist? Like, what got you into that?
Okay, so as I told you, like everybody has to go to medical school and they have to do their rotations and things like that. So when I started medical school, it's funny, I wanted to be an OBGYN. Even before I went to medical school, that was my thing. I want to be an OBGYN. But once I started medical school and I did all my rotations, I felt more at home. That's what I would describe it. I felt more at home when I was doing my psych rotations. I felt that I was able to connect with the patients. I felt that I was truly enjoying it. At the end of the day, I didn't feel like coming out of the unit. So that's a kind of a sense that I felt like, you know what, this is nice. I like doing this. I'm passionate about it. And that's what got me into psych. And then once I was doing psychiatry, I really enjoyed my child and adolescence. I like talking to teenagers. So it kind of like, helped me. I was able to connect. And I felt like, you know what, this is nice. For a change, I'm talking to people and they are listening. Isn't that a great feeling for all of you guys? So that helped. And that's what like clinched me for child and adolescent psych.
So people say that journaling is good for your mental health. Could you give a little bit more of a scientific look into that? Or
journaling is great for mental health. Just imagine if you're having all your thoughts and all your thoughts are like, in your head. You cannot make head or tail out of it. Think of it as like a math problem. That is a complex math problem, right? You look at it, it's going to look very tough. But once you started solving step by step, once the first step leads to the second step, leads to the third step, to the fourth step, and then finally you get to the answer, it becomes much easier when you write it down, right? Instead of trying to do it in your head. It is the same thing. Journalism is the same principle. So you have all these thoughts. Excuse me. You don't know what to do with those thoughts, right? And then you start writing them down. You see that there is a clarity in your thoughts. You see things that looked much bigger than before, doesn't look much bigger or more stressful at this point. And that's how journaling helps. And journaling, it is also cathartic. You take your thoughts out and you pour it on a piece of paper. So you are getting all those emotions out. Let's say like what you are writing down or very traumatic or very painful. One of the things that we also suggest is like you journal and you feel like, this is too much to handle. We also ask them to rip the paper out. Just the process of ripping it out and throwing it out is a cathartic process. Just like writing them down is a cathartic process. So journaling is very, very helpful because it is going to make the complex problems break down into chunks of easily solvable issues for which there are solutions.
So what do you think are some ways that we can help raise mental health awareness and the connection to the heart more now these days?
See, one of the things is like when anybody has a cardiac event, one of the things that they need is a support. Just being there and being supportive is the first thing. And also opening up the conversation about it is okay to feel this way. Just like, one of the questions Shivankar asked about like, toughing out. You don't go and tell like a cardiac patient about just tough things out. And you don't tell them, oh, everything is going to be fine, because then they would think of it as like a false hope and false pretense. So just being there, but also encouraging them to say, like, you know what, they are not alone in this. As you guys know, cardiac illness is rampant. When you look at the statistics, so many people end up having heart attack, diabetes, high blood pressure, a lot of those kind of like cardiac events. So there is a whole world of people who are in the same boat as they are. One of the things that would make people take a step back and realize, like, you know what, I can handle this, is the sense that I am not alone in this. So just making them understand that they are not alone in this journey, that they are not doing it all by themselves, that there is support outside. And it is okay to feel sad, and it is okay to feel anxious, because those are part of the healing process. And there is help available. And also getting help for that as in a non-judgmental way, and take the stigma out of it, is going to go a long way in not only for their mental health recovery, but absolutely for your cardiac health recovery. Imagine if you are going to be in a stress-free environment while you are, like, you know, recovering from a cardiac event, you are going to do better. And that's what it is about.
You brought up some really great points. Thank you.
Thank you.
As a psychiatrist, do you feel that you're respected in the medical field?
I think like all specialties are respected, some more than others, but I think it comes from the people's perspective. This is how I'll say: if you break your bone, you are going to respect your orthopedic surgeon at that point. If you have a cardiac event, at that point, you don't care about the orthopedic surgeon. You're going to respect your cardiologist. Let's say like you are going through a depression and you want to get out of that phase. You're going to respect your psychiatrist at that phase more so than your orthopedic surgeon. So each physicians and each specialties have our own role. And I think that we are equally respected, but it's a question of when one of them is appreciated and respected is going to depend on what your patient is going through at that point in life.
Okay.
I have a question. Is there a difference between what medication you'd give to an adolescent with depression or anxiety versus an adult with depression or anxiety?
The medications are the same. Some of them are approved for children and adolescents, and some of them are approved for just adults only. It depends on their liver function test. But usually the dosage is different. And there are some medications that's only prescribed for adults, which are not prescribed for children, and vice versa too. For example, that there is a medicine called Intunif, which is an alpha-1 agonist medication that is used to treat impulsivity in children. In adults, it is an anti-hypertensive medication. It decreases the blood pressure. So I would not necessarily use that medication in an adult, which has a propensity to decrease the blood pressure. For children and adolescents, the medicine does not decrease the blood pressure. So it's kind of like, the medications also work very differently in children and adolescents, depending on the liver function test. So there are some differences in that, yes.
With non-drug interventions, who would you say needs more time to heal mentally? Is it adolescents or is it adults?
When you look at non-pharmacological intervention, the time frame is the same, whether it is adolescents or adults. Usually for adolescents, there is positive and negative for both. For adolescents, when they are having a major life stressor, their stressors are not usually associated with the financial stressors or a major life stressor. And they usually have the support system. So they might recover quicker with a non-pharmacological intervention. And particularly for children and adolescents, we go with a non-pharmacological intervention first. When you look at adults, by the time they are grown up, they usually have some arsenal of coping skills, right? That they have gone through life. So they would have some amount of coping skills at this point. So because they have had their coping skills, usually when adults end up with depression, it usually ends up because of a biological reason for it, or because of a cardiac event or a life-changing event. And they end up on medications more so than children and adolescents.
So which one is more effective, treating a patient who has mental health issues with drugs or without?
See, drugs has a role in that. Same way non-pharmacological intervention has a role in it. So it is kind of like, for example, if let's say like if somebody has diabetes and they're diagnosed as first-time diabetes, the doctor is going to prescribe medications depending on your blood glucose levels and how much it has affected your other organs, right? For somebody who is like, borderline high glucose levels and HbA1c in the borderline level, they're going to just say like, lifestyle changes, monitor your diet, start exercising and come back and see me in 3 months' time. It's the same thing with psychiatry too. If I'm seeing somebody with a milder case of depression or anxiety, I'm going to suggest a non-pharmacological intervention, like a CBT, like a supportive therapy or interpersonal therapy for a period of 6 to 12 sessions, and then revisit to see if they need medications. On the other hand, if I see somebody who is depressed and anxious and they have negative thoughts or suicidal thoughts, I'm going to start them on medication first. That is similar in any kind of specialties, depending on what is the presentation of any particular patient and what is the severity of the illness. That's what is going to decide.
Thank you. Does anyone have any final questions before we wrap up the event for today? Because it's almost 5 p.m. Okay, so if you don't, I guess we'll wrap up our session for today. Thank you so much, Dr. Muttaswamy, for explaining how, for sharing your insight on the interconnected mind and heart. We once again appreciate you taking your time out of your day to be part of this event. And thank you all for attending. We hope you've gained valuable insight from our session today and continue to prioritize your mental and heart health.
Thank you so much for giving this opportunity. Good luck for everyone. Take care. Bye-bye.